Based on ICD-10 CM guidelines, whenever you code diabetes mellitus along with diabetes mellitus, we need to code long-term use of diabetic medications. But as a guideline, it looks very simple. But while it is very problematic to understand what type of long-term use of diabetes medications we need to code. Why means we have different types of codes like long-term use of oral hypoglycemic drugs, long-term use of insulin, as well as long-term use of non-insulin diabetic medication. So in this session, we are going to learn diabetes medication coding secret, insulin, metformin, and combination drugs coding. After watching this session, if you feel this session will be useful for you in day-to-day coding, please click on like button and also encourage your friends to subscribe to FastCoder21. So in this session, first we will see definition. So what is diabetes mellitus? Next we will see types of diabetes. Next we will see what are the long-term medications as well as its codes. And also we will see few ICD-10 CM guidelines related to long-term use of diabetic medications. And at last we will see example scenarios related to our session. So what is diabetes mellitus? So diabetes mellitus is a serious condition where your blood glucose is too high. So whenever our blood glucose is too high, usually we will call it as diabetes. In documentation, you will see it as DM or diabetes mellitus. Mostly the higher levels of blood glucose is due to does not produce enough insulin or produced insulin will not act appropriately. And also sometimes our body can't produce insulin as it required. So this is the definition of diabetes. Next we need to understand types of diabetes. Okay, so mainly we have two types of diabetes, type 1 and type 2. In type 1 diabetes, patient can't make any insulin at all. Okay, so defaultly patient can't make any type of insulin. In coding, usually we will use E10 for type 1 diabetes. In type 2 diabetes, where most common type of or default diabetes is E11 or type 2 diabetes. Here patient makes insulin but it can't work effectively. So that is the difference between type 1 and type 2. In type 1 diabetes, patient can't make insulin. Okay. So in type 2 diabetes, patient can make insulin but this insulin will not be effective. So that is the difference between type 1 and type 2. So along with type 1 and type 2 diabetes, we also have gestational diabetes. Means during the pregnancy, patient will get this gestational diabetes. And also we have latent autoimmune diabetes in adults. Usually in the documentation, we will see it as LADA. Okay. So in all types of diabetes, patient can't utilize the produced insulin. So in all types of diabetes, glucose can't enter into muscle tissues, but whereas it builds up in the bloodstream of the patient. Because of that reason, patient will get diabetes mellitus. So these are the common medications you will see in the medical coding. So for example, if you want to code Z79.4, you need to use this for injectable insulin. So what are the examples here? Humulin, Novolin, Novolog, Admelog, Limjev, Tresiba, Levamir, Lantus, Toujeo, Basalgar, and Simgli. So these are the common injectable insulin. Whenever you see these types of medications in your chart, you need to code Z79.4. Okay, so where we will use Z79.4 for injectable insulin. Next we have Z79.84. Okay, so oral anti-diabetic medications. What are the examples for Z79.84? Precoz, glycate, glucophage. Most of the time we will see glucophage, and otherwise we will see it as metformin, and also you will see it as Janumet. are Genuvia, Ribellusus, Paraxiga, Invocana, Jardines, Tiglatro, Actos, Tregenta. Okay, so basically this is simple. Whenever you see these medications in the documentation, you need to think physician or patient is taking oral anti-diabetic medications. Okay, and new one we have Z79.85 non-insulin injectable. Okay, so these are basically not insulin, but these are injectable anti-diabetic medications. What are the example? Trulicity, Victoza, Mounjaro, Ozempic, Bydureon, Zepbound, and Wegovy. So these are the common examples for non-insulin injectables. So what is important here? Whenever you code live chat, you need to check what is the medication name. Okay, for example, in the documentation, if you see Lantus, so directly you need to understand physician is mentioning about injectable insulin. Okay, for example, in the documentation, you will see metformin. Just instantly, you need to have idea that patient is taking oral anti-diabetic medications, where we will use Z79.84. For example, in the documentation, you will see Mount Jaru. So don't get confused. In the documentation, our physician most of the time prescribe Mount Jaru for like obesity also. Okay. So whenever you want to code this Mount Jaru, you need to check the documentation whether patient is having obesity or diabetes. So if the patient is having diabetes as well as patient is on Mount Jaru, you need to use Z79.85. Next, we will see few ICD-10 CM guidelines related to this long-term use of anti-diabetic medications. So, what is the first guideline? Diabetes mellitus and the use of insulin, oral hypoglycemic, and injectable non-insulin drugs. So, for example, in the documentation, you will see patient is having diabetes mellitus, where physician will not mention any type of diabetes, but patient uses the long-term use of medications. So, that time defaultly you need to code it as E11.9 diabetes mellitus type 2, as well as you need to code Z79 series based on whether it is a diabetes drug using insulin or oral hypoglycemic or non-injectable insulin. So if the documentation contains Z11.9 or if the documentation does not specify any type of diabetes mellitus, you need to code E11.9 as well as Z79 series codes. For example, patient is having diabetes and physician is treating patient with oral hypoglycemic drugs as well as insulin. Okay, so that time we need to code Z79.4 long-term use of insulin as well as Z79.84 long-term use of oral hypoglycemic drugs. For example, in a different scenario, physician will prescribe or patient is on both oral hypoglycemic as well as non-injectable oral hypoglycemic drug as well as use of injectable non-insulin anti-diabetic drugs. So that time we need to use Z79.84 for oral hypoglycemic drugs as well as we need to code Z79.85 for long-term use of injectable non-insulin anti-diabetic drugs. So what is important here? If the patient uses oral hypoglycemic drugs as well as insulin, we need to code both Z79.4 as well as Z79.85. For example, patient uses both oral hypoglycemic drugs as well as injectable non-insulin drugs. So that time we need to use Z79.84 as well as Z79.85 based on ICD-10 CM guidelines. So if the physician uses Z79.4 insulin temporarily, we can't code it as a long-term use of Z insulin. Now we will see few example scenarios. So for example, patient is with diabetes mellitus on metformin and Victoza. So as based on our previous discussion, Victoza is a injectable non-insulin drug. So here, so the reason for these medications is diabetes. So we need to code diabetes as the PDX and metformin is a oral hypoglycemic drug. So for that we need to use Z79.84 as Victoza is a injectable non-insulin drug. We need to use Z79.85. So our next scenario is patient has secondary diabetes mellitus due to cystic fibrosis and is on Lantus, Jardines and Trulicity. Okay, so here patient is on three types of medications. So Lantus is a insulin, Jardinase oral hypoglycemic, and Trulicity is the injectable non-diabetic drug or injectable non-insulin drugs. So here we need to code E85.9 first. Next, this is the code for cystic fibrosis. Next, we need to code the reason for this diabetes. So this is secondary diabetes. The reason for secondary diabetes is cystic fibrosis. So we will code underlying conditions as the PDX and we will code E08.9. This is the secondary diabetes code, and always as usual we need to code Lantus, then oral hypoglycemic drug as well as Trulicity for injectable non-insulin drug. So thank you guys. So thanks for watching this video. If in any way looking for any type of same day surgery training, IPDRG, SCC, CCS certification training, contact 707-526-3939. So if you like this session, please click on like button and also please share it with your friends.